There was a box of Kleenex sitting on the table, you know, the table on rollers. And it was right there, and I could just reach it and get it. And there was no problem, no pain, no nothing, so I could just slip down out of the bed with my feet and stand and reach it. Well, I couldn't reach it. So I put my hand on the movable table, and it collapsed, and I went with it, and we went clear across the room. I was mad at the table.
And one thing we also want our patients to know that if there is something a little out of your reach, don't try to reach for it for yourself. Just call us.
And I didn't see any sense in bothering them because they were out of the room, probably with somebody else who needed help. And it would just take me a minute. It was stupid and overconfident. I can't tell you how embarrassed I was.
We want them to feel comfortable to call us at any time, no matter how many times it may be within an hour. We don't really care because, you know, their needs come first.
Well, I thought my stay would be 2 or 3 days until I was able to go home because I had had a partial knee replacement and I was doing very well. But when I fell, I was a month in hospital.
Month and a half.
Month and a half. And that was a big difference. I hadn't counted on that. And the second thought was I've broken my hip. I really fell hard. The end result was a hip replacement the next day. I'm dependent on others, and that bothers me. So it's changed. I don't know what else to say. I can't drive my car. I probably won't drive again. That takes away a lot.
It has changed a lot of things. And also, I think that my mom was a lot more independent, and now she's lost a lot of her independence.
You have to be waited on. It's just awful to be that dependent and to know you've caused so much change in their lives. Jill couldn't work. She has to come home and take care of her family and mine.
Just listen to what they say and don't feel bad to push the button. You're not bothering them. You're bothering them more if you fall.
And after surgery, you may be feeling great because you're on pain medication. That pain is under control. You're feeling good. You feel like you can just, you know, take on the world. But it's not that easy because you might get up, you might feel dizzy, you might have some confusion, and that is a really high risk for a fall. And that's something that we want to try to assure the patient that we want you to get up and we want you to move, but we want you to be safe.
I think it definitely the pain medication had an effect because you have almost a feeling of euphoria that everything is wonderful and there's no pain and no problems, no nothing. And you can't trust that. It's just, you don't make the good decisions.
Because sometimes patients feel like they really need to perform to get out of here, to get moving, and to be independent. And it's hard. It's hard to allow us to take care of them sometimes. But if we can get the family to help us with that, it makes a big difference.
Well, I decided my leg was okay. You know, I had had some help before I went into surgery. The nurse helped me into the restroom, but this time she was busy with something else, and I thought, what the heck, my leg feels fine. Why should I have to have a nurse do it? I'm 80 years old and I've been doing this on my own for a good many years. So I got out of bed. Now, I didn't realize I'd had some anesthesia and I was just a little bit wobbly. But instead of calling the nurse like she told me to do, I decided I would go all by myself. And over I went. I didn't break anything. I got a few little bruises, but that's what happens to a stubborn old 80-year-old man, you know.
Well, one of the first things I do when I admit a patient to our unit is to orient them to their new surroundings, introduce them to the call light, show them how to use a call light, and emphasize to the patient that if they need anything, no matter what it is, to always call for help, because I want them to be comfortable. I want them to know that we are here for them. We want to make their stay as safe as possible, and we want them to leave here with a good feeling about Loveless.
You know, they got those little red buttons on the side of the bed, and that's to let the nurse know that I need some help. Well, I should have pushed that little red button, had the nurse come over to help me to the bathroom, and then even if my leg wasn't, you know, totally all there, I would have been fine because the nurse would have been there helping me in and out, and that's what I needed.
They beg you to bother them. They want you to call them. They want you to push that button anytime you need anything, no matter what, even if it's just a cone. And I think that's what people have to learn, that they're there to help you and to serve you, no matter whether you like that analogy or not. That's exactly what it is. They help you do every single thing, and they want to do it.
The most effective tool, and the thing that I'd like for all of our patients to hear, is sitting right at your bedside. It's actually your call bell. And the reason I say that is because there's no reason while you're here visiting us just for a couple of days, you can't have somebody wait on you hand and foot. And so if you ever need to get out of bed, just push the call bell. Your nurse will be more than happy to come assist you, or another member of the hospital staff will.
They're so kind and so good. They never once did anyone scowl or make you feel like you were imposing, or no matter what. So there's no reason not to call for help. It's so simple. Just follow the instructions the nurses give you and trust them. And that's all there is to it.
Well, every patient that enters Loveless Westside Hospital should receive the best care they've ever received. And part of that is making sure it's safe. And so we're thankful we've had this opportunity to share some things that you can do to help us help you in the process of you getting better and being treated in a way that you deserve to be treated. And I'd also like to thank you for choosing the Westside Hospital for your procedure or your hospital stay.